Good afternoon, everyone. I'm here to give presentation on clinical study of efficacy and safety of oral pilocarpine in the treatment of severe dry eye disease. We have no financial interest to declare. Severe dry eye disease is a multifactorial disease with varied presentation of foreign body sensation with or without visual disturbance. When its presentation is severe and refractory to conventional therapy or tear substitution treatment, it can lead to a compromised quality of life. Our aim was to evaluate the efficacy and safety of oral pilocarpine in the management of aqueous deficient severe dry eye disease, which is refractory to conventional topical ocular tear film substitute. Prospective study was done on continuous 32 patients who fitted into our inclusion criteria. Study was conducted at Government Medical College, Betia, Bihar between June 2022 to May 2023. Patients of severe dry eye disease having Schirmer below 5 mm, disabling foreign body sensation, and compromised quality of life were included in the study. Patients with history of allergy to pilocarpine, bradycardia and bundle branch block, gastritis, diabetes, glaucoma, peripheral myopic degenerations, and pregnant and lactating mothers were excluded from the studies. Informed consent was taken from each patient. Baseline pre-treatment Schirmer test, T-BUT value, global subjective responses were recorded and compared with those of post-intervention with oral pilocarpine tablet of 5 mg once a day for 4 weeks. And enrolled patients underwent general examination, fasting blood glucose level, ECG. A subjective overall symptoms were recorded. Fluorescein staining was done to see superficial epithelial erosion, if any. Infrared photograph of meibomian glands were also taken to look for any damage of the gland. Same repeated at the end of 4 weeks. Tear substitute and other treatment which the patients were taking were continued. 1 tablet of pilocarpine was given orally under direct supervision on day 1 at 11 a.m. Patients were directed to report any discomfort. Schirmer test, T-BUT value, and global responses were recorded 60 minutes after the oral dose of pilocarpine. Patients were prescribed the same dose of oral pilocarpine for 4 weeks, and follow-up was done on 1st and 4th week. Patients were asked to follow up after 1 week to assess any untoward effect, if any. At 4th week follow-up, Schirmer, T-BUT, and global responses were recorded and compared with those of pre-treatment. Here are the results of the patients who were included in the studies. Here's the summary. Overall subjective improvement was seen in all patients. There were mean improvement of 4.37 mm in the Schirmer value and mean improvement of 3.03 seconds in T-BUT. The result was analyzed by using two-tailed t-test and found highly significant for both T-BUT and Schirmer test. Pilocarpine is a widely used silologue. Oral pilocarpine is approved for management of dry eye in Sjogren's syndrome and has been ascertained to be effective in dry eye. Our study shows similar effect of improvement who were otherwise refractory to the tear film substitution without significant adverse effect, though we do not rule out that many of them may be a case of Sjogren's syndrome. So we can conclude that oral pilocarpine is a safe and effective in otherwise healthy individual in relieving symptoms of severe dry eye disease who are refractory to various tear film substitutes. Here are the photographs showing pre and post-treatment references. Thank you.
Thank you, Dr. Ruchi. Question?
What are the side effects reported by the patients for oral pilocarpine?
So there were not many side effects, like minor side effects like salivation, sweating, gastritis. These kinds of side effects were mainly reported. We counseled the patient earlier, so the patient was like, okay, I'm going to face such kind of, so they didn't panic.
Long-term continuation means how many days the patient will use it lifelong or what?
Ma'am, we have given them for 4 weeks only, but we have not.
Dry eye is a lifelong disease.
Yes, ma'am, but we discontinue and then again we give. We do not give in a continuation period.
How you are going to implement it in your day-to-day practice? What is your message? For 4 weeks the patient will stop it just to see that the patient is okay?
Ma'am, as physicians,
or you have to continue it. How it works actually, pilocarpine and the conjunctiva and the dry eye?
Ma'am, there was study for Sjogren's syndrome. Physicians use oral pilocarpine 15 mg dose. So in our case, we are not dividing the people in who are suffering from Sjogren's syndrome or who are healthy people. So we decided to give 5 mg of dose.
See, the dry eye can be of the reason are various. It can affect the aqueous, it can affect the meibomian gland. In which particular group this is working? Have you divided them, classified them?
No, ma'am, it was like a aqueous deficient dry eye.
Aqueous deficient
yes,
dry
ma'am.
eye.
And the patient whose meibomian gland was healthy or kind of, we examined the meibomian glands and all.
Okay.